So, good afternoon, and thank you for the opportunity to talk about the role of preoperative biliary drainage and the impact of multidrug-resistant bacteria from intraoperative bile cultures on short-term outcomes after HPB surgery. So it is well known that an hepatic jejunostomy is a very risky procedure, and it is well known that a preoperative jaundice deserves an extremely tailored approach, and that MDR bacteria come from a non-optimal antibiotics usage. So we had tried to figure out what's the incidence of infection related to the presence of PBD, and what's the incidence of MDR bacteria in infected patients, and third, what's the relationship between MDR infection and postoperative outcomes. So we performed microbiological cultures from bile or rectal or pharyngeal swab in the preoperative period when possible, and from intraoperative bile in all cases, and postoperatively from bile or abdominal drain fluid or blood sample whenever we got fever or sepsis or purulent discharge. Microbiological culture results were divided into three categories: as negative, positive without MDR bacteria, and positive with MDR bacteria. And as a result, the biliary infection rate was higher in PBD patients. And these were the microorganisms responsible for the biliary infection in our patients. So what about the impact of PBD on outcomes? So the overall morbidity was higher among PBD patients, but no differences came out when we took into account every single postoperative complication, maybe due to the size of the population. And the multidrug resistance bacteria in abdominal drainage fluid were more frequent, again, among PBD patients. And this is maybe more meaningful. The postoperative overall morbidity rate and postoperative severe morbidity rate were higher among MDR positive patients, and the postoperative length of stay was longer as a consequence. Organ space surgical site infection were more frequent among MDR positive patients, and MDR bacteria from abdominal drainage fluid were frequent, again, more frequent among MDR positive patients. Interestingly, there was an agreement with the microbiological results between intraoperative bile cultures and abdominal drainage fluid cultures as a regard the main detected pathogen in 50% of the patients, and in 24% of the cases, this agreement was complete as a regard the phenotypic resistance profile of the microorganisms. So, in conclusion, PBD is associated with bile infection, abdominal drain fluids contamination, and higher overall morbidity rate. And MDR bacteria in bile are associated with a worse postoperative course and longer hospitalization. Thank you.
Thank you for the nice talk. The paper is open for discussion. Any question on the floor? Maybe I have two questions. The first question is, what is the policy in your department for antibiotic treatment, preoperative in HPB surgery? And the second question is the policy for drainage, intraoperative drainage.
Okay. Okay, so starting from the first question, we have a protocol according which the preoperative antibiotic therapy is based on ampicillin and sulbactam, and unless the patient has an allergy. And I think with the result of this study, we will change, if some results are possibly available before the surgery, I think we will sure change the preoperative drugs for the patient, of course, based on the microbiological results of the culture. And that it's related also to the second question, because we use PTBD, almost PTBD for proximal strictures, and no very seldom the nasobiliary drainage. Okay, and for distal stricture we prefer ERCP and ARNBD. So it's not every time possible to get a bile sample before the operation. And yeah, I know the difference between a nasobiliary, but as Nagido said once, the Italian patients are not so patient to stay with that cannula.
Yeah. In your group, the patient who had a biliary drainage versus non-biliary drainage, there was a higher bile leak. Can you explain that?
This population includes hepatic resection, major hepatic resection with bile duct resection and reconstruction, and pancreatic duodenectomy. So maybe in this case the result maybe not representative in this case, you mean, because what is, do you mean the PBD versus not PTBD? PBD?
Okay.
Yeah.
I think for time purpose we have to move on.
Okay.
Thank you very much.